Good morning and welcome to today's Oncology Data Advisor interview. Today I'm being joined by our guest, Dr. Christopher Iannuzzi from Hartford Healthcare, and he's here today to tell us about Fairfield Cancer Center and the Varian Ethos radiation therapy system for prostate cancer that is being offered there. Dr. Iannuzzi, thanks so much for coming on today.
Thanks so much for having me.
Absolutely. To start off, would you like to introduce yourself and share what you do?
Certainly. I'm a radiation oncologist. I serve as Medical Director of Radiation Oncology and Chairperson of Oncology at St. Vincent's Medical Center, which is the Fairfield Region Cancer Institute for Hartford Healthcare.
Wonderful. Looking forward to chatting with you today.
Thank you.
Great. So first of all, would you like to tell us a little bit about Fairfield Cancer Center and its status as a care partner of Memorial Sloan Kettering Cancer Center?
Yes, we are very proud that the Cancer Institute at the Fairfield Region is the first care partner for MSK. And a care partner allows us to use the same standards of care that are used at MSK. So how a patient is worked up, how a patient is treated, and how a patient is followed is the same whether you're at MSK or at our cancer center. We undergo a rigorous quality review process on a regular basis to maintain those high standards, and we're frequently audited to do so.
Great. It's really exciting, especially that you're the first care partner of MSK.
Yeah, we're very proud of it.
Absolutely. So I know that Fairfield is offering the first Varian Ethos radiation therapy system in Connecticut, which uses adaptive intelligence to personalize treatments in real time. So first off, could you explain to us what exactly adaptive intelligence is?
Yeah, so adaptive intelligence is a concept of adaptive planning and artificial intelligence. And we leverage those two technologies to be able to deliver a very precise and personalized radiation plan for patients.
Great. And then what is the Ethos system and how does it work?
So the Ethos system allows, as we said, for what's called adaptive planning. And the way that it works is that when a patient generally gets standard radiation therapy, their plan is usually based on an image or a CAT scan that's done days or weeks before they start their treatment. What's different about the Ethos is that every day that a patient comes in, a new image is taken, and then automatically this system can actually identify the tumor and all the critical structures and rapidly develop a new plan on the same day based on that day's anatomy that is much more personalized and refined to the situation and to the patient of that day.
That's incredible. And how does using the system improve outcomes for patients, especially compared with standard options?
Well, theoretically, if you have more precision and more accuracy, then you are delivering a more effective dose to the tumor, and you're delivering less dose to critical normal structures in that area. So that should lead to better outcomes, better cancer cure rates, and less toxicity or side effects from the treatment.
That's amazing. Are there any patients for whom Ethos would be particularly beneficial?
Yeah, I think that Ethos is best used for patients that have tumors that are next to organs that potentially shift. In our clinic right now, we've started using the Ethos machine mostly for prostate cancer and specifically for what's called stereotactic body radiation therapy for prostate cancer. That's delivering high doses of radiation over short periods of time, so that only takes 5 total treatments. And what the Ethos allows us to do is if there's differences in how the rectum or bladder is filling or empty, and those are structures that are right next to the prostate, we can make these fine adjustments from treatment to treatment. In the future, we could actually use this for other things such as pancreatic cancer, rectal cancer, GYN malignancies, and we'll be starting to implement that over time.
That's great to know. It's really amazing. So awesome. As I wrap up today, anything else you'd like to mention about Ethos? We're coming off of Prostate Cancer Awareness Month in September. Anything you'd like to mention there? Any insights?
Well, I'd say that for prostate cancer awareness, I would say, it's very important for patients to visit their primary care physician and talk about prostate cancer and talk about whether getting a PSA and a digital rectal exam is appropriate for them using a shared decision model, getting informed. In terms of our cancer center, we want people to know that they will get not only the greatest and best technology and clinical expertise, but that we've built that center with the idea that we take care of the whole individual. There's holistic care. We've created a healing environment. We recognize that patients don't really want to go to a hospital every day, and so we feel that coming to our Fairfield Cancer Center, they'll find that to be more of a healing environment where they'll be more comfortable.
That's wonderful to have that option. So thank you so much, Dr. Iannuzzi, for coming on today to tell us about Fairfield Cancer Center and what's being offered there and all these exciting advances. So thank you again.
Yeah, I really appreciate the opportunity. Thank you very much.